Hello, I'm Barbara O'Neill, and today we're discussing a life-saving topic, recognising early warning signs of a stroke. Strokes can strike suddenly, but the body often sends subtle signals up to a month beforehand. Knowing these signs can make a critical difference in treatment and recovery. Stroke doesn't discriminate, it can affect anyone, so understanding these symptoms is vital for everyone. Let's explore 7 key warning signs that could save your life or someone you love. Let's begin. Before we begin, I have exciting news to share. We've launched our exclusive Holistic Health YouTube community where you'll get weekly remedy tutorials, healing guides, and more. As a special thank you, the first 100 members will receive a free copy of my book. Click join below to become part of this wonderful community. I can't wait to welcome you. Now let's dive into this amazing remedy together. One of the earliest and most alarming symptoms that can signal an impending stroke is sudden confusion. Imagine a scenario where someone you know, or even yourself, typically sharp and articulate, suddenly starts to find basic conversations difficult to comprehend. This isn't just about forgetting minor details. It's about a sudden and profound inability to process simple information. This symptom arises because a stroke disrupts the normal function of the brain, the control centre for all our cognitive capabilities. Strokes typically occur when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. Specifically, when the areas responsible for cognition and processing are affected, whether through a blockage, ischemic stroke, or a bleed, hemorrhagic stroke, it impairs the brain's ability to operate normally. This disruption manifests as confusion, which can be an early warning sign of a stroke. It's crucial to recognise that this confusion isn't typical. It's sudden and intense. People experiencing this symptom may find themselves unable to follow simple instructions, or they might feel lost in a familiar setting. For example, a person might be puzzled about the purpose of a routine task at work, or they might not be able to grasp the plot of a television episode that would normally be straightforward for them. Physiologically, strokes that affect the left hemisphere of the brain, which is responsible for language and processing, are likely to lead to confusion related to language. However, confusion can also result from strokes affecting the right hemisphere, which might manifest not in language difficulties, but rather in unusual behaviour or a severe misinterpretation of ordinary situations. Moreover, this sudden confusion can be accompanied by other cognitive symptoms like short-term memory loss or sudden emotional fluctuations, which further complicates the individual's ability to manage daily tasks. These signs are often overlooked or misattributed to fatigue or stress, which is why understanding and recognising them as potential stroke symptoms is crucial. If sudden, unexplained confusion occurs, it's vital not to dismiss it. Although it might be tempting to attribute such changes to less serious causes like sleep deprivation or mental strain, in the context of stroke, timing is critical. The sooner a stroke is recognised and treated, the better the chances of recovery and minimising permanent damage. Thus, immediate medical attention is essential when this kind of sudden change in mental status is observed. Recognising this symptom and responding promptly is not about causing panic. It's about empowering yourself and others with the knowledge to act swiftly and potentially save lives. The ability to identify and react to this early sign of a stroke could make a significant difference in outcomes. Another critical early warning sign of a stroke is difficulty with speech, known medically as aphasia. This isn't just stumbling over a few words, it's a significant impairment in the ability to speak or comprehend language. For someone experiencing this symptom, words might come out jumbled, their speech may be slurred, or they might not be able to come up with the words at all, a condition known as expressive aphasia. Alternatively, they might hear others speaking but can no longer understand the words, which is known as receptive aphasia. Why does this happen? The brain's language centres, predominantly located in the left hemisphere, are integral for processing and producing speech. A stroke that affects these areas can disrupt this capability, leading to the symptoms of aphasia. The severity of the speech difficulties can vary depending on the extent and specific location of the brain affected by the stroke. Consider a scenario where an individual suddenly finds it hard to articulate their thoughts during a conversation, or they can't seem to grasp what others are saying, even though they know the language well. Such changes can be particularly alarming and are often very noticeable to others around them. It's not uncommon for someone with this symptom to become frustrated or distressed due to their sudden inability to communicate effectively. Importantly, these speech difficulties can occur in isolation or alongside other symptoms of a stroke, such as weakness on one side of the body or sudden confusion. However, even if trouble with speech appears as the sole symptom, it should be taken very seriously. If you or someone else experiences sudden changes in speech, whether it's trouble speaking or understanding, this could be a sign of a stroke and immediate action is required. The key action here, as with any stroke symptom, is to seek medical help right away. Quick response to such symptoms can significantly influence the overall outcome and can sometimes prevent more severe consequences of a stroke. Remember, strokes are medical emergencies and the symptoms can progress rapidly. Therefore, recognising and reacting to early signs such as trouble with speech can be crucial. It's not just about medical intervention, it's about ensuring quality of life post-stroke by minimising potential long-term disabilities. As we continue to discuss stroke awareness, keep in mind that knowledge and prompt action are powerful tools in the fight against stroke. A third early warning sign of a stroke that should never be overlooked is unexplained dizziness or a sudden loss of balance. This isn't just feeling momentarily unsteady, it's a profound and persistent sensation that can significantly impair one's ability to stand or walk safely. This symptom can be particularly deceptive because it's easy to attribute to less serious issues like inner ear problems or mere fatigue. However, when it relates to a stroke, it signifies something far more severe. Dizziness and balance issues in the context of a stroke are often the result of a disturbance in the brain areas that coordinate our spatial awareness and motor control. The posterior circulation of the brain, which includes structures like the cerebellum and brainstem, can be affected during a stroke. These regions are crucial for maintaining balance and coordinated movements. When they're compromised, the body's ability to regulate these functions falters. Imagine suddenly feeling the room spin or finding yourself unable to walk across a room without holding onto something for support. Or consider a scenario where someone stands up and feels so unbalanced they must immediately sit down. These experiences can be signs of a stroke, disrupting the intricate balance system controlled by the brain. The symptom of dizziness or loss of balance can be accompanied by other neurological signs like coordination problems, double vision, or slurred speech. However, even in isolation, these symptoms demand immediate attention. It's important to understand that such dizziness or balance difficulties are not typical and should not be dismissed as just being clumsy or tired. If you or someone around you experiences these symptoms suddenly and without a clear cause, it's crucial to consider it a medical emergency. The immediate step should be to call for medical help. Recognising and responding to this symptom swiftly can be the difference between recovery and significant disability. As with any stroke symptom, the sooner medical intervention begins, the better the outcomes can be. Understanding that strokes can manifest as problems with balance and coordination helps broaden our vigilance. It's not just the dramatic symptoms like paralysis that warrant concern. Subtler signs like dizziness are equally critical. Let's keep this knowledge at the forefront and ensure that we react quickly to protect ourselves and our loved ones. A sudden, severe headache with no obvious cause is another alarming sign that could indicate a stroke, specifically a hemorrhagic stroke, where bleeding occurs within the brain. Unlike typical headaches or migraines, this type of headache is characterized by its extreme intensity and rapid onset. It can feel like a sudden explosion or a thunderclap in the head, often described by sufferers as the worst headache of my life. The reason behind this symptom is the pressure build-up from the bleeding in the brain, which not only damages brain cells but also irritates the surrounding brain tissues, causing severe pain. This kind of headache is more commonly associated with hemorrhagic strokes, which account for about 13% of all stroke cases. These occur when a weakened blood vessel bursts and bleeds into the surrounding brain, contrasting with ischemic strokes that result from a blockage. Imagine you or someone you know suddenly clutching their head in agony, unable to tolerate the pain, which seems to have come out of nowhere. This is not a typical headache that might be relieved with over-the-counter medication. This is a medical emergency that requires immediate attention. The sudden onset of such a headache, particularly if accompanied by other symptoms like nausea, vomiting, or an altered state of consciousness, is a critical sign that cannot be ignored. The risks associated with ignoring such a headache are severe. The longer a hemorrhagic stroke goes untreated, the greater the damage to brain cells due to increased pressure and continued bleeding. This can lead to long-term disabilities or even be fatal. Therefore, if you or someone else experiences a sudden severe headache of this nature, it is crucial to seek emergency medical services immediately. Quick diagnosis and treatment can greatly improve the chances of recovery by managing the bleeding and reducing pressure in the brain. Vision problems can be a significant early warning sign of a stroke, manifesting as sudden trouble seeing in one or both eyes. This can include blurred vision, double vision, or even a sudden loss of sight. Unlike gradual vision impairments related to other health issues, the vision changes associated with a stroke are abrupt and can be quite severe. The cause of these vision disturbances during a stroke lies in the interruption of blood flow to the parts of the brain responsible for processing visual information. The occipital lobe, located at the back of the brain, is primarily involved in visual processing. When a stroke affects this area, it can disrupt the brain's ability to interpret and process the signals it receives from the eyes. Consider someone who suddenly finds they can't read texts they could easily read just moments before, or someone who starts seeing double when their vision was fine earlier. Sometimes the effect might be as dramatic as a curtain falling over one side of their vision, leading to partial or complete blindness in one eye. These symptoms are not only disorienting, but can also be terrifying for the individual experiencing them. It's important to distinguish these symptoms from those caused by less severe issues like eye strain or a migraine. Stroke-related vision problems are usually very sudden, without any apparent cause, and do not improve by resting or using typical migraine medications. They might occur in conjunction with other stroke symptoms, such as numbness or weakness on one side of the body, confusion, or difficulty with coordination and balance. When sudden vision problems occur, they should be treated as a medical emergency. Immediate medical evaluation is essential, as timely treatment can often restore blood flow to the affected areas of the brain, potentially saving sight and preventing other stroke-related damages. To anyone experiencing these sudden vision changes or observing them in others, the best action is to not delay seeking medical help. Calling emergency services or getting to a hospital can make a significant difference in outcomes. Remember, when it comes to strokes, every minute counts. Numbness or weakness on one side of the body is a classic and highly indicative symptom of a stroke. This symptom typically manifests as a sudden loss of strength or a strange numbness in the arm, leg, or even the face, and it usually affects only one side of the body. This can make it difficult for the affected person to move their limbs, maintain balance, or even perform simple tasks that require coordination. The biological basis for this symptom lies in the way strokes impact the brain. Strokes usually affect one hemisphere of the brain, either the right or the left. Since each hemisphere controls the opposite side of the body, a stroke on the right side of the brain will result in weakness or numbness on the left side of the body, and vice versa. The affected regions in the brain are those responsible for muscle control and sensory processing, which explains the sudden dysfunction in these areas. Imagine waking up or suddenly finding that you cannot feel your arm or leg, or that your face feels droopy and you can't smile properly. Such symptoms can be startling and are often noticeable to others as well. For instance, one might see a person's face suddenly drooping on one side, or they might observe someone struggling to walk or keep their balance due to the weakness in their leg. This symptom of stroke, numbness or weakness, is not subtle and should never be overlooked or dismissed as fatigue or a sleeping limb waking up. When these signs appear, they require immediate medical attention. The quicker the response to these symptoms, the better the chances of limiting the damage of the stroke and enhancing the recovery process. For anyone who experiences or observes such symptoms, the recommended course of action is to perform a simple test. Ask the person to smile, raise both arms, or speak a simple sentence. Difficulty in performing any of these tasks could confirm the presence of stroke symptoms and should prompt an immediate call to emergency services. Understanding and reacting promptly to this sign of a stroke can make a profound difference in the outcome. Early medical intervention can often restore the affected functions and prevent long-term disabilities. This knowledge is vital not just for potential stroke victims, but for everyone, as recognising and responding quickly to signs of a stroke can save lives and preserve quality of life. Sudden, inexplicable fatigue or tiredness can also be a subtle yet significant early warning sign of a stroke. Unlike normal fatigue after a long day or from physical exertion, this type of tiredness is profound and comes on suddenly without an obvious reason. It's an overwhelming sense of exhaustion that might prevent individuals from performing their daily activities, even if they've had a good night's sleep or haven't engaged in any physically taxing tasks. This symptom occurs because a stroke can affect parts of the brain that regulate energy levels and alertness. When the blood supply to these areas is disrupted, it can lead to an acute decline in stamina and an unusual need for sleep. The brain requires a constant supply of oxygen and nutrients to function efficiently. Any interruption to this supply can significantly impact its ability to manage energy levels. Imagine someone who is usually active and alert, suddenly feeling so drained that they can hardly get out of bed, or finding themselves needing to take frequent naps when they previously powered through the day without rest. This isn't just ordinary tiredness, it's a drastic change in their baseline energy levels, signalling that something may be wrong internally. Fatigue related to a stroke might also be accompanied by other neurological symptoms such as confusion, difficulty speaking, or changes in vision. However, even if fatigue appears as the only symptom, it should not be ignored. It's crucial for individuals and their families to recognise that such unexplained tiredness, especially when severe, could be an indicator of a stroke. If sudden fatigue is observed, especially alongside any other unusual symptoms, it's advisable to seek medical attention immediately. Quick response in such cases can be critical. Many people tend to write off fatigue to less severe health issues or lifestyle factors, but when it is a sign of a stroke, identifying and treating it promptly can save lives and reduce the risk of long-term disability. As with all potential stroke symptoms, awareness and education are key. Understanding that sudden, unexplained fatigue could be a warning sign of a stroke empowers individuals to take swift action. Encouraging a culture of attention to such symptoms can lead to faster diagnoses and better outcomes for stroke victims. Thank you for taking the time to listen and learn about these life-saving signs. Let's stay vigilant and share this knowledge with others to ensure that more lives are protected. Stay tuned for more empowering health insights, and let's continue to prioritise health and well-being in our daily lives. Together we can make a difference.